Welcome to Medicare 101, understanding how Medicare works and your coverage options. This video will cover four main topics. These topics will include what Medicare is and how it works, the different parts of Medicare, how and when to sign up for Medicare, and the additional coverage options that are available to you. So what is Medicare and how does it work? Let's start with what it is. Medicare is an insurance program provided by the federal government that offers coverage to people who are 65 years or older or people who are under the age of 65 with certain special needs. Since Medicare is an insurance program, it's important to understand some basic information about how its coverage works. First, Medicare does not offer any out-of-pocket maximums for coverage, which is another way to say that there is no cap on the total costs you can accrue for the health care you receive while enrolled in Medicare. Second, there is no coverage offered outside of the United States. So Medicare will not cover the cost of any health care you might receive while abroad or traveling outside of the United States. Third, while you're enrolled in Medicare, you can see any doctor that accepts Medicare. You will not need a referral. And finally, Medicare coverage is broken out into four parts: A, B, C, and D. So, what are these four parts? We'll start with the parts of Medicare coverage that are provided by the federal government. These are parts A and B, which cover a percentage of the costs associated with both hospital stays and medical services, and together are often referred to as Original Medicare. Now, parts C and D represent additional coverage options that are available to you through private insurance companies that have contracted with the federal government. And in order to be eligible for these, you must be enrolled in parts A and B. Part D refers to prescription drug coverage, which is not included in parts A and B, so it can either be added to them or included within Medicare Part C coverage. Now, Medicare Part C represents Medicare Advantage plans. These plans are also offered through private insurance companies who are contracted with the federal government and provide all the benefits of Parts A and B while offering additional benefits like eyewear coverage and free annual physicals, as well as cost limits like annual out-of-pocket maximums, which would cap the total out-of-pocket expenses you could incur in a given year. These plans come with or without Part D drug coverage and are often viewed as a way to consolidate all of your Medicare-related coverage into one place while also receiving additional benefits and cost controls Parts A and B alone don't offer. We will dive into your additional coverage options a little later in the video, but first, let's look at Parts A and B in a little bit more detail. Medicare Part A is often referred to as hospital insurance and provides coverage for things like overnight stays in hospitals and nursing facilities. Most people pay no premium for Part A, which is typically referred to as premium-free Part A. You qualify for premium-free Part A if you or your spouse, or a former spouse, paid Medicare taxes for a total of 40 calendar quarters, which adds up to 10 years. While the premium is free for most people, there is a deductible of $1,316 per benefit period. A benefit period begins when you enter the hospital or nursing facility and ends once you have been discharged and remain out of the facility for 60 days in a row. So it is possible to pay multiple Part A deductibles in a given year. Part A also does not have an annual out-of-pocket maximum, so there is no cap on the total costs you can accrue in a given year. Medicare Part B covers medical services, which include things like visits to your doctor or specialist and outpatient hospital care where you're not required to stay overnight, and other services and supplies that are needed to diagnose or treat a medical condition you may have. Medicare Part B monthly premiums can vary depending on your income, but fall within $134 and $428.60 per month. There is also an annual deductible of $183 as well as coinsurance. Medicare Part B will cover 80% of the Medicare approved amount for a medical service, and you will be responsible for the remaining 20%. This is your coinsurance amount. Just like Part A, there is no annual out-of-pocket maximum, so there is no limit to the total costs you can incur through Part B coverage. Now, before we review the additional coverage options available through Medicare Parts C and D, we'll look at how and when to enroll in Medicare Parts A and B, because you must be enrolled in Parts A and B in order to be eligible for Parts C and D. So, how do you enroll in Medicare? Some people are automatically enrolled in Medicare Parts A and B. If you are already receiving Social Security benefits, then you will automatically be enrolled in Medicare, and your coverage will start on the first day of the month in which you turn 65. And your Part B premium will automatically be deducted from your Social Security payment. If you are under 65 and living with certain special needs, you'll also be automatically enrolled after you've received your disability benefits from Social Security. If you are not automatically enrolled, you'll need to contact Social Security during an enrollment period to sign up for Parts A and/or B. Generally, people who are 65 but not currently receiving Social Security benefits will fall into this group. The initial enrollment period is your first opportunity to enroll in Medicare. It's a 7-month enrollment window around your 65th birthday that includes the 3 months before your birthday month, and the 3 months following your birthday month. Your actual Medicare coverage will begin based on when, within this period, you enroll. However, enrolling in any of the first 3 months of your initial enrollment period will give you coverage starting on the first day of the month you turn 65. While IEP represents your first opportunity to enroll in Medicare, many people who continue to work past the age of 65 defer enrollment. However, to defer, you must have insurance coverage equivalent to Parts A and B through an employer or a spouse. Otherwise, you may incur penalties in the form of higher Part A and B premiums if or when you do enroll in Medicare. It is common for most people who are still working during their IEP periods to defer Part B and its premium costs. However, many people who qualify will take this opportunity to enroll in premium-free Part A because there is no premium cost. When you defer Parts A and/or B because you are still working, you qualify for what is called a special enrollment period. There are many scenarios that qualify you for a special enrollment period, such as moving to a new town or state, or moving in or out of a skilled nursing or long-term care facility. But continuing to work past the age of 65 is the most common for people who are new to Medicare coverage. In this scenario, your special enrollment period allows you to sign up for Medicare any time while you're still covered through you or your spouse's employer, or within 8 months after you or your spouse's employer coverage ends. If you have not signed up by the end of the 8-month window, you will have to wait until the general enrollment period. The general enrollment period applies to anyone who wishes to enroll in Medicare but missed the initial enrollment period or did not qualify for or missed their special enrollment periods. When you enroll during the general election period, your coverage starts later, and you may be subject to penalties incurred for any time you didn't have coverage equivalent to Parts A and B through an employer or spouse. The general enrollment period runs annually from January 1st through March 30th. When you enroll during this period, your coverage will not begin until July 1st of that year, leading to a coverage gap for many people who enroll at this time. Before we delve into your additional coverage options, let's talk a little bit more about the Part A and B penalties we've been referencing. These penalties are only incurred if you did not have coverage through an employer or spouse while you were eligible for Medicare. And, of course, they only apply if you do decide to enroll in Medicare. So, what are they? Well, for Part A, there's a 10% penalty on your Part A premium for twice the number of years you could have been enrolled in Part A but were not. For Part B, there's a 10% penalty on your Part B premium for each 12-month period you were eligible for but did not enroll in Part B. This is paid for as long as you are on Medicare. Of course, it's important to note here that, as we've stated before, if you are still working and have equivalent coverage through your employer, union, or spouse and defer Medicare Part A and/or B enrollment, you will qualify for a special election period and not be subject to a late enrollment penalty. Now that we've covered Parts A and B and how to enroll in Medicare, we can look at what additional coverage options are available. Remember, Original Medicare, Parts A and B, do not cover all of your expenses. As we've talked about, Part B is a 20% coinsurance you're responsible for, and Part A has a $1,288 deductible per benefit period, and neither offers an out-of-pocket maximum that would cap the total costs you could incur. These additional coverage options can provide you with more cost certainty, additional benefits, as well as prescription drug coverage. Medicare supplement plans, also known as Medigap plans, are provided by private insurance companies contracted with Medicare and are used to cover the out-of-pocket expenses associated with Original Medicare, so Parts A and B. You can add a supplement plan to Original Medicare, again Parts A and B, and when you choose a Medicare supplement plan, Medicare remains your primary insurer. Medicare Part D is how you obtain prescription drug coverage when you're on Medicare. However, Part D is provided through private insurance companies who are contracted with Medicare. You can add Part D to Parts A and B, either with or without a supplement plan. Medicare Part C, also known as Medicare Advantage plans, are also provided by private insurance companies who are contracted with Medicare, but when you enroll in a Medicare Advantage plan, the private insurance company becomes your primary insurer. These plans offer all of the same benefits as Parts A and B, but can also provide you with additional benefits not included with Original Medicare coverage. They can also come with or without Part D coverage. And here it's also important to note that if you have a Medicare supplement plan, you cannot get a Medicare Part C plan. And if you do get a Medicare Part C plan, it either comes with or without drug coverage. You cannot purchase Part D separately. Let's take a look at Medicare Part D in more detail. The first thing to understand is that prescription drug coverage is not offered through original Medicare, so Parts A and B. It is added in the form of Part D. The pie chart here shows how these three parts of Medicare fit together. As we've already covered, Part D is provided through private insurance companies who are contracted with Medicare, but like Parts A and B, failing to enroll in Part D when you first become eligible can result in a penalty if and when you do choose to enroll. But also like Parts A and B, if you defer signing up for Part D while you have equivalent coverage through either an employer or a spouse, you will not be subject to this late enrollment penalty. Part D coverage is broken into 4 coverage stages, which are based on year-to-date prescription drug spending by both you and your insurer. Your out-of-pocket costs are determined by which stage you are in throughout the year. The first stage is the deductible stage. In this stage, you must meet the deductible, which is the amount you are required to pay out of pocket before your plan will start to pay its share of your covered drugs. Not all Part D plans will have a deductible, but if your plan does, you will remain in this stage until you have met the deductible for the year. The second stage is called the initial stage. Here you will pay the copays for your prescriptions based on your Part D plan's coverage. Once you make the copayment, your plan will pay the rest of the cost of the prescription. You remain in this stage until the total costs of your prescriptions reach $3,700. This includes your copayments and the amount your Part D plan pays. Once you hit this threshold, you move into the coverage gap stage. This is also known as the donut hole. In this stage, you will pay 51% of the cost of generic drugs and 40% of the cost of brand name drugs. You remain in this stage until your total out-of-pocket drug costs reach $4,950. Once that happens, you move into the catastrophic coverage stage, the final coverage stage of Part D. In this stage, you pay the greater of 5% of the cost of the drug, or $3.30 for generic drugs, or $8.25 for brand name drugs. And then you remain in this stage through the end of the year. So now that we've covered how Part D provides prescription drug coverage, let's look at Medicare supplement plans, which are also known as Medigap plans. These plans cover many of the out-of-pocket expenses we talked about that are associated with Parts A and B, so things like the Part B 20% coinsurance or the Part A deductible could be covered by a Medicare supplement plan. In order to enroll in a Medicare supplement plan, you must already have Parts A and B, but you can enroll anytime. You do not need to wait for an election period. They are taken anywhere Medicare is accepted because Medicare remains your primary insurer. You can also add Part D coverage to Medicare supplement coverage to provide a more comprehensive coverage solution. This is illustrated in the pie charts here. Coverage set up this way will result in having 3 different plans and/or providers. So you'll usually have 3 separate insurance cards. Parts A and B will be through Medicare, for which you'll use your Medicare card, while Part D and your supplement plan will be through private insurance companies. Again, usually each with their own cards. Your other coverage option is through Medicare Part C, or a Medicare Advantage plan. Like Part D and Medicare supplement plans, you must already be enrolled in Parts A and B to enroll in a Medicare Advantage plan. But in this case, the private insurance company becomes your primary insurer rather than Medicare. Medicare Advantage plans offer all the same coverages that come with Medicare Parts A and B, as well as additional benefits that don't. These may include eyewear and fitness benefits, hearing care coverage, and fixed cost limits that are not included in Parts A and B, like set co-payments for doctor and specialist visits and annual out-of-pocket maximums to cap the total cost you can incur in a given year. Additionally, many Medicare Advantage plans are offered with or without Part D prescription drug coverage, removing the need for a separate Part D plan. This also allows you to carry just one insurance card, the card you would receive from your Medicare Advantage plan. The pie chart here shows how Medicare Advantage plan coverage works. You'll notice that Parts A and B are included in the coverage and that Part C Medicare Advantage plans can come with or without Part D coverage. When enrolled in a Medicare Part C plan, you cannot enroll in a separate Medicare Part D plan. You must select a Part C plan with or without Part D coverage. Enrolling in a Part C plan is similar to enrolling in Medicare for the first time in that you can sign up for a Medicare Advantage plan when you enroll in Medicare for the first time during your initial enrollment period, or during a special election period like when you're ready to retire and will stop receiving health care benefits through an employer or spouse. However, with Medicare Part C, there is one more important enrollment period. This is called the annual election period, and it runs from October 15th through December 7th of each year. During this time, you can move from original Medicare or a supplement plan into a new Medicare Advantage plan, or switch from one Medicare Advantage plan to another, either to a new insurance provider or a new plan with the same insurance provider. When you enroll during the annual election period, your coverage will begin on January 1st of the coming year. The only way you can enroll outside of the annual election period, your initial enrollment period, or a typical special election period is when the Center for Medicare and Medicaid Services gives a plan their highest rating of 5 stars. When a plan that is available in your area receives this distinction, you are entitled to a special election period, which allows you to switch into that plan anytime between January 1st and November 30th. In 2016, Tufts Health Plan Medicare Preferred received this distinction of 5 stars from the Center for Medicare and Medicaid Services. That concludes our Medicare 101 presentation. But before we go, here are a few questions to ask yourself as you navigate through the coverage selection process. First, what can you afford? Second, what benefits do you want, and what benefits do you actually need? And third, what plans do your providers accept? Keeping these questions in mind as you start to explore the different plans and coverages available to you will help you make the right decision for your individual situation. And finally, before we go, here's a list where you can get more information about Medicare and Medicare coverage. TuftsMedicarePreferred.org or THPMP.org, Medicare.gov, or the Social Security website, SSA.gov. Thank you for watching our presentation, and be sure to visit us at TuftsMedicarePreferred.org. Thank you.